How can secondary bone cancer cause fractures? Imagine your bones as strong, supportive structures that hold you up and protect your organs. When cancer spreads to these bones from elsewhere in the body, it can weaken them in ways that make fractures more likely, even without a serious injury. This process is called secondary bone cancer or bone metastasis. It happens when cancer cells travel through the bloodstream or lymphatic system and settle in the bones, disrupting their normal structure and function. One way secondary bone cancer causes fractures is through bone destruction. Some cancers, like breast cancer, produce substances that activate cells called osteoclasts. These cells break down bone tissue in a process known as osteolysis. As the bone is resorbed, it loses density and strength, becoming fragile. This weakening can happen gradually, and often the bones break with little or no trauma, which are called pathological fractures. For example, a person might experience a fracture from simply twisting or even during normal activities because the bone has become so weakened. Other types of cancer, such as prostate cancer, can cause abnormal bone formation, known as osteoblastic lesions. Instead of destroying the bone, these cancers stimulate the growth of new bone. However, this new bone is often disorganized and structurally unsound, which can also lead to weakness and increased risk of fractures. Sometimes, cancer metastases involve both destruction and abnormal formation, creating complex changes that compromise the bone's integrity even more. The process becomes a vicious cycle. Tumor cells in the bone releases factors that stimulate bone breakdown. When bones are resorbed, they releases growth factors stored within the bone matrix. These growth factors then promote further tumor growth and more bone destruction, accelerating the weakening process. As the bones become more fragile, the risk of fractures rises significantly. Clinically, this means that bones affected by secondary cancer are more prone to breaking even with minor stresses. These are called pathological fractures and can cause severe pain, reduce mobility, and sometimes compress nerves or the spinal cord if the vertebrae are involved. Detecting these changes early is crucial. Doctors use imaging tests like X-rays, bone scans, CT scans, MRI, and PET scans to identify bone metastases and assess fracture risk. Treatment focuses on controlling tumor growth, strengthening bones, and preventing fractures. This can involve radiation therapy to shrink tumors, surgery to stabilize bones with rods or plates, and medications called bisphosphonates or denosumab that help slow bone loss. Managing pain and maintaining quality of life are also key goals. In summary, secondary bone cancer causes fractures mainly by disrupting the delicate balance of bone remodeling. The cancer cells weaken the bones through destruction or abnormal formation, making them prone to breaking even with minor stresses. Understanding these mechanisms helps healthcare providers develop strategies to prevent fractures and improve patient outcomes. If you or someone you know is dealing with bone metastases, it's important to work closely with medical professionals to manage the condition effectively.